The Ministry of Health on Monday launched the Gambia Mental Health Investment Case Report 2025, a strategic document highlighting the economic and social benefits of increased investment in mental health. The report is intended to guide policy decisions and support effective planning for mental health services across the country. Speaking at the launch, Vice President Mohammed B.S. Jallo observed that for far too long, mental health has been obscured by silence and stigma, prevailing over genuine understanding. He stressed that mental health issues touch every family and that the time has come to dismantle this silence. The Vice President emphasized that mental illness carries no inherent shame, arguing that the mind, much like any other part of the body, requires healing. Vice President Jallo called for a fundamental shift in the nation's approach to mental health, asserting that it must be addressed with the same urgency and resource allocation as any other critical health issues. He stressed the necessity of open dialogue and greater compassion to destigmatize mental health challenges. The Vice President warned that the Gambia cannot realize its vision if its populace remains burdened by distress, trauma, or hopelessness. He underscored that mental health descends mere medical concern, defining it instead as a national development priority, a human rights issue, and a moral duty. By fully acknowledging this, he argued, the country can successfully work towards creating a more supportive and inclusive society.
Our government, under the leadership of His Excellency President Adama Barrow, is committed to ensuring that mental health is not left behind in our journey towards universal health coverage. We are working to ensure that care and compassion reach every region, not only in our hospitals and clinics, but in schools, workplaces, and communities. We are reforming laws and policies to protect the rights of those living with mental health conditions.
Minister of Health, Dr. Lamin Samate, held this achievement as a turning point in the Gambia's journey towards a healthier, more inclusive and compassionate society. He emphasized that mental well-being is now rightly recognized as a critical and integrated component of overall health in the country. The minister added that the Gambia's mental health investment case provides a clear roadmap for strengthening care programs and clinical services, focusing on accessible, cost-effective, and culturally appropriate measures.
This report provides us with the evidence we need to act decisively and boldly. It shows that investing in mental health is not only a moral imperative, but also an economically sound, socially transformative activity, and which is very essential for achieving universal health coverage that we all yearn for.
Amadou Kamara, chairperson of the National Assembly Health Select Committee, reaffirmed the Assembly's support for the ministry's initiatives, particularly in advancing mental health legislations. He expressed optimism about the forthcoming mental health bill, which he said will reinforce the country's commitment to protecting and promoting mental well-being.
These are bills and legislation that affect our people directly, the people that we represent. And like I always said, if anything affects the Gambian people directly, it affects us because they are the ones that put us where we are. We are their representative. If you touch them, you touch us. If you prioritize them, you prioritize us.
Also speaking at the event, Carl Frederick Paul, the United Nations resident coordinator in the Gambia, described the launch as timely, coinciding with the global commemoration of World Mental Health Day. He emphasized that mental health is central to human dignity and a fundamental right recognized under international law. Paul also warned of the rising challenge of substance abuse, which has become a major driver of mental health issues in the Gambia and beyond.
Good mental health enables children to learn and reach their full potential in education. It empowers women and girls to participate in full society. It enables people to engage in decent work and contribute to economic growth, and it is essential to reducing inequalities and building peaceful and inclusive societies.
Mental health encompasses emotional, psychological, and social well-being. shaping how individuals think, feel, and act. It determines how people cope with stress, realize their potential, work productively, and contribute to their communities. Reporting for Kerfatu, I am Makutumani.